On June 9, 2024, the Lagos State government declared a cholera outbreak. 324 suspected cholera cases were reported, with 15 deaths and 40 recoveries. Oyo and Ogun states have had their share of the epidemic, with about 1,500 suspected cholera cases reported by the Nigeria Center for Disease Control and Prevention (NCDC) across 30 states since January 1, 2024. On this week's edition of the Tracker, we will examine the causal factor, the status of Ondo State, and efforts to prevent the state against the disease. My name is Joy Pius. Welcome to the program. Cholera has always been a significant public health threat in many parts of the world, particularly in regions affected by natural disasters, conflicts, and inadequate infrastructure. Large outbreaks of cholera continue to occur wherever there is poverty and people lack access to clean drinking water and sanitary disposal of human waste. A severe cholera epidemic occurred in Haiti after the earthquake in 2010 and lasted until 2017. During this outbreak, over 820,000 people became ill and nearly 10,000 died. An outbreak in Yemen started in 2016 and has not yet ended. This outbreak has had even greater devastating effects. Over 2.5 million people in Yemen have become ill and almost 4,000 have died. It is thought to be the largest fast-spreading cholera outbreak in modern history, and at its peak in 2019 accounted for over 90% of cholera cases in the world. Haiti also had a new outbreak that started at the end of 2022. After the country has been declared cholera-free for 3 years, it has not yet ended. Cholera outbreaks have increased globally since 2021, and reported cases doubled from 2021 to 2022. In 2022, 7 countries in Africa and Asia reported outbreaks of more than 10,000 cases each. Cholera doesn't know borders. Despite being preventable and easily treatable, children continue to suffer from the potentially fatal disease. After years of steady decline, cholera has made a devastating comeback. More than 1.1 billion people are at risk, with children under 5 especially vulnerable. The intestinal infection often spreads because of a lack of clean water and sanitation facilities. Children living in volatile and unstable communities are particularly at risk. Nigeria is currently experiencing cholera outbreak, and it ranks number 1 globally among countries with the highest number of people defecating in the open space, and is widely off track to meet the target set by the Sustainable Development Goal (SDGs), and is crucial to prevent waterborne diseases like cholera. As of June 24, 2024, the National Center for Disease Control and Prevention (NCDC) reported 1,528 suspected cases of cholera and 53 deaths across 31 states and 107 LGAs in Nigeria since the beginning of the year. The case fatality rate is 3.5%. The NCDC has also placed Nigeria on high risk for increased cholera transmission and impact due to the rainy season. Open defecation, or the act of defecating in open-air locations instead of in covered ones is a widespread practice in Nigeria, creating a perfect storm for cholera outbreaks. In 2021, the Water, Sanitation and Hygiene National Outcome Routine Mapping (WASHNOM) report estimated that 48 million Nigerians, or 23% of the population, still practiced open defecation, while only 8% practiced hand washing. The number of fatalities of the cholera outbreak are increasing daily, and the main cause of the outbreak has been linked to contaminated water and poor sanitation hygiene, made worse by the rainy season, which can spread the water through flooding and unsafe water sources. The states most affected include Bayelsa, Lagos, Zamfara, Abia, Bauchi, Cross River, Ebonyi, Delta, and Katsina. In the southwest region of Nigeria, 3 states have recorded cholera outbreak, which includes Lagos, Oyo, and Osun states. What measures can be deployed to contain the spread?
We have about the outbreak. We're almost about in almost 31 states. So, and as far as we are concerned, we are trying to sensitize people to make sure that they live in a very clean environment. Then they take care of the water they are going to take. And even of recent, we had even from the news that all these sobo and all these things that are not well prepared with good water should not be taken. But the most important thing is that people should live in a good way of life. That is, the environment is very, very, very essential. Keep away flies, keep away stagnant water and everything.
Sometimes it's toilets. So no watching toilets, they cause cholera. Open toilets, they cause wahala for cholera. They watch the selling market of fish, no cover them, they cause cholera. Plates, no need, you no watch them, they cause cholera. And the back compound, the piece, the toilet, they cause cholera. And the woman, the pikin shit for po, it drop po, had to not watch it, they cause cholera.
You will see the flies. You know, these flies we have here, they can cause cholera to human health. That we perch on the cough, someone split out and go to the same something that we make use of. It's very bad. And this our state also, we need good waters, not good tap waters here.
We need to look at it very well, critically, because the way we dealing with our environment matters a lot. The cleaning up of our gutter and make sure that there's no open defecation and ensure we have a drainage system. In the local communities, yes, we are having issue because during the dry season, most of the water, they depends on solely on the water from the streams. And those water normally dry up during the dry season. When the rain start falling, likely the rain might wash such a defecation to those streams. And when people drink those water, it lead to cholera. So such outbreak might be more patent in the local environment. But what really necessary is to see how we can ensure we have a clean environment and make sure that we have a good drainage system. This issue of breeding of vectors like mosquito, like housefly, what do you call it, cockroaches. All these vectors carry a lot of diseases. Cockroach now is responsible to so many issues that have to do with Lassa fever. The issue of malaria is caused by mosquitoes, and without cleaning environment, we always have all these vectors multiplied. So the multiplication of these vectors is a serious concern to human communities.
Ondo State, being among the few cholera-free states, is now making concerted efforts to prevent outbreak of the communicable disease in the state. What are the symptoms and precautionary measures that must be taken? The Director for Disease Control and Immunization, Ondo State Primary Healthcare Agency, Dr. Victor Akinpelumi, urged residents of the state to prioritize personal hygiene and sanitation practices, adding that the agency has started sensitization about the disease in the local government areas of the state.
Cholera as a disease is a disease of dirty environment, and it's being caused by eating a contaminated food with virus called Vibrio cholerae, and it's not only by food. It's also by water and other juice or fruit, anything that goes into the mouth that has already been contaminated with this virus will cause the disease cholera. It is cholera in the sense that the presentation of the disease is so unique in the sense that the infected person or the victim will exhibit a kind of signs and symbol, and which includes, abdominal pains, fever ranging to up to 40 degrees Celsius, and the ultimate is vomiting and passage of watery stool, and that is the cholera, the diarrhea aspect of it. And like I said, it's a disease of dirty environment. And while somebody is passing, fluid out of the body through the mouth and the anal cavity, then you begin to see that the person will begin to lose weight, lose dehydrated, and at that material time, the person becomes so restless, and if care is not taken, is going to choke, and that is called hypovolemic shock. And this is a very terrible and very bad situation. It is majorly making your environment to be very clean, otherwise called environmental hygiene. Your personal hygiene is also very key in the sense that you need to have clean hands before you eat, and that means you really need to wash your hands with soap and clean water from time to time, and you have to cut your fingernails short this time around, and for our children, we have to sing it into their earrings that they need to continue to wash their hands with soap and clean water from time to time. And it is very important to ensure that we dispose our fecal matters, our waste products, our waste materials appropriately in the way that is in tandem with WHO recommendation. And that is what we call sanitary ways of disposing our waste. So far, so good in Ondo State as we speak. Ondo State has never recorded any confirmed case. And that is why I want to say that people in Ondo State should, remain calm, and let's go about our normal day-to-day activities. And I also want to let the public in Ondo State know that the government of Ondo State is not at rest. It has, engineered every sector that is concerned with the management and maintenance of health system in Ondo State into action, and that is why we are here, of course. And I also want you to know that there are sensitization going on in our various communities using the established structure. We have our social mobilization officers that are talking about all of this in various communities, in churches, mosques, marketplaces, and other social gatherings. We also have our disease surveillance and notification officers that have been trained on how to identify this disease, and when they do so, they immediately notify, and we swing into action into curbing the disease or containing the disease at that material level.
An environmental officer, Dayo Gidingbe, urged residents of a state to prioritize personal hygiene and sanitation practices.
We are sensitizing people right from the market, from the street, to ensure that we live healthy, we live in an healthy environment. consumption of food should be an healthy consumption. We should consume food that are prepared under strict supervision, and water as well. We consume, and we'll talk about water. We have products that are produced by water in different forms, apart from the sachet water we see around. So our advice, our work these days is to ensure that we move around in accordance with our Yoruba name, Wole Wole now. So we move around the house, the streets, the markets, to ensure that at every point of productions, that whatever we are taking in form of water, in form of food, is healthy, is sanitary, and is consumable at every point in time.
Speaking on Ondo State government's efforts in maintaining cholera-free status, Permanent Secretary, Ministry of Health, Dr. Niron Ikuomola, hinted on government's preparedness by constituting various committees comprising relevant stakeholders to include Ministry of Education, Water and Environmental counterparts, among others, to look into the best way to prevent the disease in the state.
Our goal is to prevent and to tackle any emergency that may come in the way of infectious disease or communicable disease or any form of disease that is health-related. The Honorable Commissioner will be the chairman of that committee, and other relevant stakeholders or ministries are also included: Ministry of Environment, Ministry of Education, Water Resources, and so on and so forth. Okay, so we have that team in place. That's a committee for emergency preparedness. We also have a working committee or group, which we call Emergency Operations Center, EOC, at the ministry. That also is like the technical working group. Okay, that is also in place. And we have team of surveillance officers all over the state. We have at the State Ministry of Health, we have Primary Care Development Agency, and the local government. All the local governments have them, and they coordinate. There's coordination. So all of them have been put on notice, and they are really working hard to ensure that whenever we have any case, it will be picked up and necessary action will be taken. However, the preventive measures that we have put in place is that we are working, because we know cholera is food and waterborne disease. That is, it is contacted through taking dirty water or contaminated food, by somebody that has been infected, or somebody that is carrying the bacteria, Vibrio cholerae. Okay, so if somebody that is infected handles food, okay, and the food gets contaminated, and somebody eats it, definitely that person, and then you can have, if as many that eat it, definitely come down with it, okay. And if it's water that is contaminated, okay, with that bacteria, then people. So we are working on the environment side of it. We are working on the on the water side of it, on the sanitation side, and again we have also mobilized our community mobilizers, okay, or health promotion officers all over the state, to ensure that they reach out to the community and to opinion leaders to sensitize the people on the practices, hygiene practices that they're supposed to observe.
Following the revelation that the disease could spread fast in schools if not curtailed, Permanent Secretary, Ondo State Universal Basic Education Board, Dele Akinagbe, announced that boreholes and toilet facilities have been provided across primary schools in the state, while necessary actions are also ongoing.
We have started to collaborate with other government agencies to ensure that our people are aware of the need to prevent this disease. But even before this outbreak in Subeb, we have been embarking on a number of projects to ensure water and sanitation in our various schools. Under the various project implementation in Subeb, in the last 8 years, since the inception of the Akeredolu Ayedatiwa administration, we have been able to implement 10 years action plan. And part of the projects that we implement is the provision of boreholes in our various schools. We have hundreds of boreholes in our various primary schools, and the essence of this is to ensure good water supply for the use of our teachers and our learners. Not only that, one of the major causes is defecation, open defecation. We have tried to prevent this by way of constructing toilets in our various schools. Under the 2013 to 2016 action plan that was implemented between 2017 and 2020, containerized toilets were provided, and subsequently again we have done a good number of toilets for our various primary schools for the use of both the teachers and the learners. And like I earlier said, we are not resting on this. The importance of hand washing is always being emphasized at our various fora. These are part of efforts that at SUBEB level that we have tried to do so as to ensure that we don't have the outbreak of the disease in Ondo State.
Another important action is the sensitization of pupils to maintain cleanliness against the deadly disease. Commissioner for Water Resources in the state, Sunday Akinwalire, confirmed that the ministry is working with other relevant stakeholders to ensure that clean and potable water is available for the people.
Part of the problems that will give rise to cholera outbreak will be obviated when we have our pipe-borne water. So to the glory of God, we want to say that Ondo State has made a remarkable progress in making sure that Ondo State people begin to take good processed pipe-borne water. And I can assure you that currently we are partnering with French Development Bank and African Development Bank to restore the pipe-borne water that will come from the Awena multipurpose dam. And recently, the French Development Bank, their officers were here in Ondo State to begin the mission. We have concluded the internal projects. We are now moving to the physical projects. Now that is where the treatment plant and other projects that which are laying of pipe and other things across the 6 local governments of the Central Senatorial District. And as soon as that one is done, we will be spreading our activities to the northern and southern senatorial districts. But just before that, there has been an approval for motorized borehole and other boreholes that could assist our people in these other senatorial districts. So you can now see that the government is better prepared than before to making sure that our people in Ondo State begin to take potable water. We are mindful of the fact that the surface water and other things are contaminated, and within the ambit of the Ministry of Water Resources, we are looking at a situation where we begin to treat boreholes and wells across the communities in Ondo State. And by so doing, it's our belief that cholera outbreak and other waterborne diseases will have been treated, and at least succor will come the way of our people in Ondo State.
As warnings from NCDC continue to resonate, it is important that the general public heed the voice of caution and embrace all safety tips against the disease.
It is hoped that with concerted efforts from government and concerned citizens, cholera will be subdued in Ondo State and Nigeria at large. We've come to the end of the program for this week. Join me again same time next week for another edition. My name is Joy Pius.